Good morning. My name is Stephen Guffey, and I'm Associate Professor of Physical Therapy at Arkansas State University. Today I want to give you a little bit of a tutorial and some information about a new product called the ThermoStim probe. We're going to be treating a chronic tennis elbow extensor epicondylitis. The ThermoStim probe is a device that allows us to deliver heat or cold, we're going to be using heat today, and electrical stim simultaneously through this probe device. If you look, the probe has a flat surface, but it also has edges that will allow us to do soft tissue mobilization while we're delivering the heat and electrical stim. We have the patient set up in the circuit so that we can deliver the stim, and we'll be delivering a biphasic waveform. We'll use a pulse duration of 250 microseconds, and then we'll use a frequency of about 5 pulses per second. The intensity of stim will be just below a motor response. Patient will be able to feel a little bit of a twitch. So we've applied some conductive medium. We're going to cover the area of the extensor origins, and the patient will begin to feel some heat there. And then we're going to start our electrical stim. Let me know when you can feel a little bit of a tingle, a little bump. Okay, good. So we'll start there. And now we're going to deliver the stim and the heat. And as we start to warm the area up and we begin to get some effect of the electrical stim, then we're going to begin to mobilize the tissue. We can start with some cross-frictional type movements. And then we can bring up on edge and really work those extensor origins with the edge of the device, once in a while changing directions and smoothing the tissue out, but then coming back to edge and working these areas that are adhered. And in effect, what we're doing is we're taking a chronically inflamed elbow that's not healing, that's kind of stalled in the repair process, and we're going to cause somewhat of an acute inflammatory response. And this is basically the point of the soft tissue mobilization, but we're able to do that with heat and with E-stim by alternating between the flat surface and the edge based on the patient's ability to tolerate and then how much friction we believe we need to break up the adhesions. Typically, we'll deliver this treatment for about 10 or 15 minutes. And then when we finish, we'll follow this with an application of light with 624 and 850 nanometer light, red and infrared light, at about 9 joules per centimeter squared.